Hello everyone! I am pleased to introduce this video presenting KOELIS technologies and their clinical applications. My name is Paul Prommel, Product Specialist at KOELIS, and I will introduce you to KOELIS Trinity, a system equipped with 3D ultrasound and patented OBT fusion technology, who brings exceptional accuracy in delineating and targeting prostate lesions. The end goal of the system is to build a full 3D mapping of the prostate for the accurate diagnostic of prostate cancer using elastic fusion, 3D ultrasound, and organ-based tracking. The first step will hence be to define a target using MRI information and perform an elastic fusion. In comparison to a simple rigid fusion, the elastic fusion will adapt the contour of the organ on the MRI to fit those of the ultrasound volume. KOELIS provides an elegant tool that will use only a few reference points and extrapolate the rest of the contour, allowing you to prepare the MRI in just a few minutes. We now have a base map on which we can build on our diagnostic strategy and, more accurately, aim and precisely track the biopsy needle. Although KOELIS Trinity is easily able to perform transrectal biopsies, our focus today will be on the transperineal technique. For the transperineal approach, the clinician will benefit from KOELIS' unique 3D Sapphire probe, which will allow him a quick acquisition of the whole volume of the gland by a simple press of a button. He will also use to his advantage the innovations such as the mini-grid linear guides or the Steady Pro probe holder to be in a very adapted and comfortable environment. Once the probe is inserted, the acquisition of prostate sample can begin. At the start of the examination, a reference volume will be taken and used to perform the elastic fusion. During the rest of the intervention, deformation of the organ will happen, which will be compensated by the organ-based tracking. KOELIS Trinity allows you to perform virtual biopsies even before inserting a needle, to ensure the position of your target line and add extra precision in your procedure. The organ-based tracking will then automatically compare the most recent acquisition with the reference volume and will update the 3D mapping with the accurate positioning of the target line. It is now possible to either take a biopsy or to adjust the aiming. Once the biopsy is performed, an updated 3D ultrasound is obtained and automatically fused back to the reference volume with a millimetric precision. By doing this, the precise location of each biopsy core can be visualized along with the locations of MRI targets. Throughout the examination, organ and patient movement can happen. Since the organ-based tracking updates continuously the 3D mapping, the aiming and recording will always keep its accuracy, making of KOELIS Trinity a verified powerful ally for performing intervention under local anesthesia. Both targeted and randomized samples can be acquired, making it a complete and accurate cartography of the prostate. You will then be able to use the full extent of the information available to select the right treatment for the right patient. The integrated KOELIS Trinity platform is efficiently designed to facilitate a range of procedures. Use the cartography to define if nerve-sparing strategy can be considered. Use our unique second look feature for active surveillance, which employs the 3D mapping of a previous session as a base map for a subsequent intervention. Or use the 3D mapping to assess the eligibility of a patient for focal therapy and then assess the possible margin and size of treatment. And now, let's see how one of our users from UK talks about this use of the KOELIS Trinity system, Dr. Simon Bott.
With the advent of MRI, things changed. We can now see the lesion we needed to target, but we had the problem we couldn't do a biopsy in an MRI scanner, at least not easily. That's when fusion biopsies came along. I think fusion biopsy is much more accurate and therefore we can take fewer biopsies. This means it's easier for the patient to undergo and we can do this procedure under local anaesthetic. If you do this procedure under local anaesthetic, it has to be patient friendly. It has to be the patient is not in too much discomfort. This means that I prefer to do this technique on the left lateral position rather than in the lithotomy position. Patients lie like they did for a truss biopsy and have a biopsy taken without the indignation of having their legs up in the air and a transrectal probe placed in the rectum. In order to make it more comfortable under local anaesthetic, I use a coaxial needle to make a single puncture into the area around the prostate. This can be infiltrated with local anesthetic, and then the needle can be targeted to different directions using the same needle so that the skin is not punctured multiple times. This makes the whole procedure much more comfortable for the patient. The other advantage of a local anesthetic is patients don't have to be prepared for an operation, and therefore all the patients I biopsied today have actually been seen in clinic this week and biopsied this week. This speeds along the process of the diagnostic pathway, which is obviously good for patients, but also helps me meet my cancer targets. So the advantage of the KOELIS kit is that we can take as many or as few biopsies as is required in order to establish a management plan for our patient. So in an older man, I might just target the lesion and not need to target anywhere else, as the patient's going to have whole gland treatment with perhaps radiotherapy. In a younger patient who might be a more suitable candidate for either surgery or brachytherapy, where more detailed planning is required, then I then take biopsies not only of the target but also a sample. Clearly the number you take in your sample depends on the prostate size, but you can target the area around the neurovascular bundle in a potential surgical candidate, or around the urethra in a potential brachytherapy candidate, or both. We found in our MDT that we're not only hitting the target with a much greater frequency, but also we're taking fewer biopsy cores in general. I have done over 150 fusion template prostate biopsies. Not a single patient has been readmitted to hospital as a result of sepsis. Patient-reported outcomes on pain are also strongly favourable. It does rely on a good team around you, so it's good to have somebody talking to the patient at the top end and a nurse assisting you while you do it. But with a good team around you, the procedure can be relatively pain-free and actually well tolerated by the patient.
Thank you for watching this video. I hope you appreciated understanding with us the importance of building a complete and precise 3D mapping of the prostate in the diagnostic and treatment of cancer. If you need additional information, do not hesitate to contact us. Thank you and goodbye.